Good afternoon. I'm Scott Hara, and today we are speaking with UMHS 2016 graduate, Dr. Miriam Bernstein. And Dr. Bernstein, I want to welcome you today. And can you please share your news with us?
Thank you. Thank you so much for having me here today, Scott.
Sure.
I would love to share my news that I recently started a new job as an OB-GYN hospitalist as well as an outpatient provider at the Upstate University Hospital in Syracuse, New York at the Community General Campus.
Okay. And before that, you worked at Oneida Health as an attending physician. Can you tell us a little bit about that experience and also about what you're doing right now?
Sure. Both are pretty similar as far as a mixture of being on the labor and delivery floor, as well as taking care of patients gynecologically with surgeries and then office management. My job now is at a much bigger health system. There's a lot more teaching involved as far as residents and medical students go as being part of a teaching university. So that's probably the biggest difference between the jobs. And then just bigger hospital comes with different resources, different opportunities. I think a little bit more opportunity for collaboration, which I'm really looking forward to.
Okay, great. And you've also worked as a hospitalist at St. Peter's Healthcare in New Jersey, as well as you were a resident physician back at MedStar Franklin Square Medical Center in Baltimore. What were some of the highlights of your residency and working at these two different hospitals?
I think the experiences both gave me such exposure to different types of practices as far as the ways that physicians can be in the same specialty but have such different management, such different approaches to the art of medicine. And that's something that I'm very grateful, excuse me, hasn't been taken away in modern medicine, that everyone seems to kind of, do things their own way while still providing the same quality of care, the same great patient outcomes. But I really appreciated the different perspectives in medicine. MedStar, I had a lot more GYN oncology exposure. And then when I was at St. Peter's Hospital for the second half of my residency, they did approximately 6,000 deliveries a year. So I got to see a little bit of everything, which was very, very appreciated before I graduated and was out on my own doing those things on my own.
Okay, great. And just looking back, what made you decide on attending UMHS over other med schools?
I think that I really appreciated the personal atmosphere. I appreciated that my interview process seemed to be very, I don't know how else to describe it, but personal. I felt that everyone was getting a chance to know me, getting a chance to know why I wanted to go to medical school. And then as soon as I set foot on the island, having such good support. I mean, I tell people I met all of my closest friends in medical school, and that has, been as true today as when I talked to you in 2016. I absolutely am so grateful for that experience. So I think it has to do with the personal atmosphere and the fact that I got to do rotations at world-renowned hospitals, and I feel like I got a really good, well-rounded education. And I do have the experience of seeing healthcare in the island of St. Kitts and seeing, the disparities that certain parts of the world have as far as their health is concerned. So it was really, really amazing to have that perspective. And then when you're in the OR here and someone drops an instrument and someone acts like it's the worst thing in the world, you're like, no, you could be hundreds of miles away from the instrument that you really need. So you should be grateful that, it's only going to take 20 minutes to get a new one. So that perspective is something that was invaluable to me from UMHS for sure.
Okay, great. And can you think about one or two things about studying at UMHS that have helped you become the doctor that you are today?
Absolutely. I mean, I think speaking to my last response as far as the resourcefulness that I learned at UMHS was amazing, and just the clinical knowledge. I was taught by people who had both academic and research backgrounds, but as well as practical backgrounds to be able to say, hey, if this doesn't go right, this is what you can do. If you don't have a stethoscope and you have to figure out what someone's lungs sound like, you can do this. So again, that resourcefulness was phenomenal. And then during my rotations, just exposure. That's the thing that you want. I tell everyone going to medical school and residency, you want to see as many things as you can so that when you get out in practice, you don't have to pull from, a textbook to try to figure out a diagnosis. You can sit there and say, okay, have I seen something like this before, and what did I do? Or what did the attending I was shadowing do? And that to me is just, yeah, it's experience. That's the only thing you have to go from sometimes.
Okay, that's so true. And is there anything else that you'd like to say to current or prospective UMH students thinking about possibly a career specifically in OB-GYN or just in medicine in general that we haven't covered? Anything you'd like to say to the current or prospective students out there?
I mean, I definitely chose a specialty that does not have always the best work-life balance, and it has a reputation for not always having the best work-life balance. However, I think that the way that medicine is changing for the better, that is something that a lot of places are really working on, as far as making sure the physicians aren't working 24/7, that you're not in a private practice and just covering yourself and with no time off, because we all understand now that self-care is really important to not only be able to prevent burnout, but to also take care of our patients in the best way possible. So I think going into a field should not just be based on lifestyle. I think that you need to choose something that you're interested in, and then understand that there isn't a one size fits all model to any aspect of medicine. Whether it's, oh, I don't want to take call on the weekends, or I don't want to do something else, but you do want to still do surgery or things like that. There are ways that you can work around that in medicine. I mean, residency and medical school off the table, you need to do what's expected of you in those
Right.
scenarios. But there is a lot more work-life balance, and I really, really appreciate that now.
Okay, great. And anything else that you'd like to say?
No, I mean, I for one moment do not regret my decision to go to UMHS. I'm extremely grateful for not only my education, but as far as the opportunities that it's afforded me in the 7 years since I graduated, and the support that I've had, as well as I said before, the amazing friendships and mentorships that I developed along the way. So thank you.